Morning. In terms of talking about family resource centers, the history of these centers goes back to the turn of the last century when immigrants were coming to this large country when immigrants were coming to this country in large numbers, primarily from Europe, and these settlement houses sprung up to help those new immigrants to acclimate and succeed with life in this new country. So on the left, you see an example of one such settlement house in San Francisco, and on the right, you see an example of that exact same location today, which is now a family resource center. And some of the supports and services that they provide are exactly the same as over 100 years ago in terms of English as a second language, because they continue to work with an immigrant community, job skills training, but also you would see many other supports and services that we know now support families and children to be healthy and thrive. Family resource centers may be community based, like the image you see at the top, which is from Vermont, or they may be school based, as the image you see from Kentucky below. And these centers are welcoming hubs of support and services for families. They work with families with an approach that is multi-generational. So you may have heard of two-generational work. Family resource centers are not only two-generational, but multi-generational. So recognizing the importance of working with the child, working with the parent, and working with the grandparents or extended family as well. They're strengths-based. So we see families as having strengths that we want to support them to further build, and they're family-centered. They are designed for all families. So they're not just for highly challenged families or low income families. They're designed for all families. An example of that, the image you see off to the right, is from New Jersey. New Jersey calls their family resource centers family success centers. There are 21 counties in New Jersey, and there are 57 family success centers. So all counties have at least one, and typically more than one, family success center. And that includes highly affluent counties as well as highly challenged counties as well, because the perspective is all families could use support. That all of us as adults, two of the most important roles we can have, being parents or being spouses or partners, we don't get any kind of support for. So, how can we support all families to succeed? Services provided are at no or low cost for participants, and they support families to build protective factors, which we'll talk about in just a second. These protective factors, which come from the Center for the Study of Social Policy, in 2005, the CSSP did research to determine were there certain factors if, when present, families were more likely to be healthy and strong and less likely to experience child abuse and neglect. And they were able to boil it down to these five factors, which you see here. Parental resilience, for example, is the ability to weather the storm, like a palm tree swaying in a hurricane. It's still standing at the end of the day. So how can we support families to be resilient like that through the challenges life faces? And these other protective factors, you can find out more information on the website there below if you hadn't been introduced to them already. And these are the factors that we support families to build at family resource centers, recognizing that as long as we're working with families, we want to be supporting them to build these five protective factors because we know these make a particular positive difference. Family resource centers have no dedicated federal funding. So they're unlike Head Start programs or after school programs or home visiting programs, all of which have dedicated federal funding. But yet, there are more than 3,000 of them nationwide that serve more than 2 million people annually. Well, how could that be? How could that be? Without dedicated federal funding, how could so many states and counties and cities, public and private funders, be investing in these centers when nobody's telling them that they have to? And the answer, simply put, is because family resource centers are a good idea. They're cost effective, so it does not take a lot to run a family resource center. They are highly adaptable, so they can work with lots of different kinds of populations, be it urban families, rural families, working with families of different ethnic groups, teen families, all kinds of different families. And they have a track record of successful outcomes demonstrated by multiple external evaluations. Family Resource Centers bundle together many services and supports that may be familiar to you already. So they create this hub that connects various services that families can access all in one place conveniently. So services such as home visiting, parenting education, health screenings, childcare resource and referral, fatherhood programs, food banks, job skills training, all coming together in one convenient place. We often say if you've seen one family resource center, you've seen one family resource center because the services and supports a particular center has are developed in relation to the particular population that they're working with. At the same time, because of research that the National Family Support Network was able to do in 2015, 2016 through funding from the Robert Wood Johnson Foundation, we worked with a research institute in Colorado to look at family resource centers across the nation and found that there were remarkable commonalities amongst the four main services that they provided. And this is what they are. The first is parenting support. So parenting support exists along a continuum from lighter touch to more intensive services. So lighter touch, you see things like parenting workshops. So workshops on different topics that may be of interest to parents, like sibling relations, infant nutrition, positive discipline. Further down, you see more intense services, parenting support groups. So when parents meeting over a period of time, providing mutual support for each other, sharing the joys and challenges of parenting and raising children. Next, parenting education series, typically offered over a period of weeks or months using an evidence-based curriculum. And finally, home visiting, the most intense kind of parenting support service with support provided in the home to families. And for states that have family resource centers as well as home visiting, it's very, very common to see these services, or it's very, very common to see home visiting connected with family resource centers. So in West Virginia, all the home visitors are based at family resource centers. And in Connecticut, all the family resource centers do home visiting. It's just a logical kind of connect to bring those pieces together. Because while it's really great to visit with families one-on-one as staff and build those relationships with them, we can't get to building the protective factor of social connections unless we connect families with other families. And that's unlikely to happen in their home or apartment. So by having this center where you can bring families together and have socialization groups, play groups, support groups, connect families to other families, that makes a big difference, as well as the opportunity to plug them into other supports and services offered at the center. The next most common service area is access to resources. And again, that exists along a continuum from lighter touch to more intensive services, with lighter touch being what we call enhanced information and referral. So that's making the warm handoff to connect families with resources and supports that could be useful for their healthy development. Next, concrete supports. So that's when there are supports directly provided at a center that could help families with concrete needs, such as rental assistance or a food bank. Next, working with families over time to address family identified goals. So in the past, people used to call this case management. We don't call it that anymore. We call it family development work. And the final one is co-location of resources. So that's when other external resources are co-located at the centers, again, to make it easier for families to be able to access them. So for example, there are WIC clinics that are co-located with family resource centers. And in many FRCs, there are different kinds of government workers who are outstationed at the centers for a period of for certain hours or days a week. That then families can go there to sign up for benefits or access different programs, which is so much more convenient than families needing to navigate across town with little kids in tow to go to some office where there isn't even a waiting area that's appropriate for their children to be in while they're trying to meet with their worker. This changes that all up because there they are at this center that's right there in their community, bringing the services and supports to them. And the last most common service areas, child development activities. So child focused development activities and parent leadership development, because family resource centers see themselves not only as social service providers, but as community builders. And this reflects that intent with things you'd see like community development opportunities, parent leadership development, opportunities to support families to have voice in their communities and take responsibility for them. So these are the most common service areas, and all family resource centers across the country provide the first two: parenting support and access to resources. We talk about those as the bread and butter of family resource centers throughout the country. So all family resource centers provide that, whether they're urban or rural, whether they have tiny budgets or big budgets, they all do those two things for sure. And it's really important to understand that family resource centers are not just a list of services. Family resource centers are these places that build community. So a huge piece of the work of Family Resource Center is building that parent caregiver community where parents and caregivers are providing peer support to each other. We know that peer support, those social connections, go a long way to reducing isolation, which is highly correlated with the likelihood of child abuse. And that as families connect with each other, they're more likely to share information, share resources, help each other out with things, build friendships that we know make a difference. These images both come from New England, one from Massachusetts and one from Vermont. So what does it cost to run a family resource center? Well, budgets vary across the country depending on the cost of living, specific kinds of programs the centers are offering, and the kind of physical space that they have. But I'll share two data points that will just give you something to work off of. In New Jersey, New Jersey Family Success Center has an annual budget of $240,000 to $300,000 with 3 to 4 full-time staff. In Kentucky, they have school-based family resource centers. So at these school-based family resource centers, they're not paying for rent, space, utilities that's already provided by the school. So they're just paying for the staff. And as a typical school-based FRC there has an annual budget of $33,000 to $82,000 with 1 to 2 full-time staff. How are FRCs funded? Well, across the country, there are lots of different ways that different different localities have pooled and pulled together and leveraged funding to make these centers happen. Mostly, you would see investments by state, county, and municipal governments. You would also see some leveraged federal funding coming into the picture through funding streams such as community-based child abuse prevention. And there's also significant foundation, corporate, individual donors, and in-kind support that you would see at various centers as well. In terms of the current pandemic that we're all experiencing, FRCs have really stepped up more than ever to support families. So when we think about what families are challenged with now and what their needs are, overwhelmingly families are looking for parenting support and access to resources. And as we just mentioned, the bread and butter of any FRC is exactly those two things anyway. So family resource centers never missed a beat in terms of responding to families during the pandemic because that's their work anyway. So when many other places closed their doors, FRCs continue to operate. And here you see images of food distribution, baby supplies, different kinds of virtual activities that they quickly converted into. In the image with the vehicle comes from Kentucky, where the family resource centers there took on the responsibility of delivering school lunches to all the children. The schools were closed. The FRC staff were still doing the work and bringing lunches out to the kids to make sure that no one went hungry. And you see them there conducting drive-by cheer-ups throughout the community to let the children know how much they and their family members were missed. So I mentioned that there's numerous positive outcomes that have been documented about family resource centers. So I'm going to share some data points here to give you a sense of them. Alabama, with its network of FRCs, they had a return on investment study that looked at these centers, and they found that for every dollar invested in FRCs, the state of Alabama saved $4.93 or received $4.93 in immediate and long-term financial benefits. So basically a 1 to 5 ratio. In Allegheny County, Pennsylvania, which is where Pittsburgh is located. They have 28 family support centers just in that one county. And they worked with the University of Chicago, Chapin Hall, to research their impact. And they found that those neighborhoods that had these centers had a 26% lower rate of child abuse and neglect investigations than similar neighborhoods without them. And that only makes sense, right? Because if we're supporting families to be healthy and strong up front, the less likely we are to see them show up in the child welfare system later. Teller County, Colorado is a semi-rural county near Colorado Springs. And since 2016, the Child Welfare Department there has partnered with the Family Resource Center to provide support for families. So through what's called a differential response system. So differential response, sometimes called alternative response, is a call comes into the child abuse hotline. The child welfare worker looks into it, determines they're not going to open a case, but you can tell that there are some issues going on with that family. So rather than just leave the family hanging, they make a referral to the Family Resource Center that's in their county, and the family can voluntarily participate in services there. Since 2016, when they moved to this system, that the county has seen a 57.7% reduction in child abuse rates. And that county only has one FRC. By working with one FRC, they've more than halved the number of children who enter into the highly traumatizing child abuse, child welfare system. Another data point from Colorado is families who participated in family resource centers through research have demonstrated statistically significant improvements in economic self-sufficiency, health, social support, caregiver child nurturing attachment, lots of other good, great things that we know support families to be healthy and strong. Also in Colorado, a longitudinal study, families who were screened out of child welfare and completed family development activities at FRCs were less likely to enter the child welfare system than a similarly matched comparison group. In fact, 37.5% less likely to have child abuse finding, and 50% less likely to have out-of-home placements at 1 year after their involvement in FRC services. Kentucky, which I've referenced before, is a really interesting story because Kentucky, some 40 years ago, excuse me, some sorry, you have to remember it's it's after 5 o'clock on the East Coast. So sorry, I'm stumbling here. So Kentucky back in the 1989 had and as you see here in 1990 had really been doing poorly with its education outcomes, and there was actually a big lawsuit, and then there was legislative reform effort to further reform the education system. And with that, there were a lot of different measures that were called for in education reform. And one of them was they thought about creating these family resource centers. So these school-based family resource centers that would provide support to the families of children in the schools, that would also work with families whose children were not school age yet to support them to be school ready. So they created this funding formula that for any school that had 20% free or reduced lunch students, they could qualify for a family resource center if they wanted one. Now, as you all know, 20% is not very high. So many schools could qualify, but they had no idea how many principals, how many school districts would actually be interested in these centers. Well, it turned out everybody was interested. And so that's why Kentucky has 856 family resource centers, all of which are school-based. And in that period of time, from 1990 till now, that the schools have moved from 45th place to among the top 15 school systems in the country. Now, there are a lot of factors that contribute to that, but definitely we know from lots of research that families' engagement in schools, when families are engaged in schools, children and schools do better. Of course, you all know that because you're here at this conference. This shows it in the data as well related to FRCs. Vermont looked at adverse childhood experiences and determined that for every family that was served by a family resource center, then that saved the state $210,000 that otherwise would have been spent on mitigating ACEs later. Now, we already talked about what it costs to run a family resource center, so you can quickly see from this data, you serve 1, 2 families, the center has already paid for itself, according to this. Going one level up, having talked about family resource centers, going one level up, we talk about how the centers are connected with each other in the fact that not only have states and cities and counties invested in these centers, but they also independently hit upon the idea and value of networking them together, recognizing when these centers come together that you can do more. So you can focus on training. You can get everyone together about what quality work looks like with families. You can coordinate services. You can advocate and address systems changes and challenges that no one center could on their own, and try to move the needle forward for families as a whole within a community or a county or a state. So with that, the most common functions of networks are listed here on this slide. I won't go into that in detail, but it's there in the PowerPoint if you want to look at it later. And now we come to the national level, one level further up with the National Family Support Network. So that's the organization that I co-founded and direct now. And when we started in 2011, these were the 8 states that were colored in green on our membership map. So these represent states that not only have family resource centers, but have also networked them together. And keep this map in your mind's eye, because this is what it looked like in 2011 when we got started. And this is what it looks like today. So the national network has rapidly grown to now 31 members, 30 states and the District of Columbia that represent more than 3,000 FRCs that serve more than 2 million people annually. And we would love to be able to color Hawaii green in on that map as well, which is what Kathleen will be talking about in just a moment. The mission of the national network is to promote positive outcomes for all children, families, and communities by leveraging the collective impact of state networks and championing quality family support and strengthening practices and policies. And our vision, simply put, is that that whole map would be green, that all families would be able to access quality family support and strengthening services in their communities, that we wouldn't think twice about there being an FRC in our neighborhood, just like there should be a good school and a park and a library. These are just building blocks of healthy communities that we want all families to have access to. This slide is about what it means to be a member in the national network. For a state to become a member, or representatives in a state to become a member, you need to have 2 FRCs that come together. So at least 2 that come together, that's the makings of a network. And once you have that, then an entity in a state can come and join the national network. So the other piece to talk about that is important and relevant at this particular time of interest to anyone, we would say whether or not you're a family resource center, is the fact that we have these nationally adopted standards of quality. So these nationally adopted standards of quality that bring together 2 important frameworks in the family support and strengthening field. Those protective factors that I mentioned earlier, along with what are called the 9 principles of family support. So these 2 frameworks come together into these standards that are designed to be used by all stakeholders. So public departments, foundations, community-based organizations, and families as a tool for planning, providing, and assessing quality practice. So as long as we're going to be working with families, how can we make sure we're doing quality work that's helping families to build those 5 protective factors? That's where these standards come in. They focus on 5 core areas of practice: family centeredness, family strengthening, embracing diversity, community building, and evaluation. And they were developed over a period of 18 months and vetted with 1,000 organizations serving all kinds of different families, urban families, rural families, all kinds of diverse families. So that ensured that these standards are such they can work in any environment. They create common language and expectations across different types of programs that serve families. So whether you're working with families in the schools or in a home visiting program or an early care and education program or a family resource center, we would say your work could be enhanced through focusing on these standards. So that's great because regardless of your particular program or funding stream, we can all get on the same page about quality work with families. They are designed to help ensure that families are supported and strengthened through quality practice, and they're available along with 4 different implementation tools for free. So all these are available for free on the National Network website. So we're not selling the standards. We want everyone to have access to and think about quality work with families. And this quick slide here shows you where the training on the standards has happened, because the network also has developed a certification training, an in-person version, and now, just like everybody else, it's a virtual training that we offer on the standards, and those who complete it actually get a certificate and you see here in this data where the training has happened across the country to date over the past years. And there's more than 8,600 people who've completed the training coast to coast. And that now leads to the Hawaii story and Kathleen.
Thank you, Andrew. Thank you so much, and thank you all for being here today. I'm very excited to be able to be working with Andrew and to share all of this work with you. I started taking a look at family resource centers back in May and did a lot of research this summer and spent a great deal of time asking Andrew many questions and talking to a lot of other folks in Hawaii who have in the past expressed interest in family resource centers as well. Andrew, if you don't mind, next slide. So what I was really hoping we could accomplish with family resource centers, and I believe that we can, is to really start to bring our resources together. A lot of times what we see, and I work for the Department of Education, and a lot of times we're working in silos when it comes to family engagement. Sometimes our schools have PCNCs, parent coordinators, but not always. They're planning family engagement activities, and then you have Title I schools and their Title I coordinator plans family engagement activities, and you have an EL, English language coordinator, and they plan theirs, and PTSA plans theirs. So how do we bring all of these people together and all of these resources together into one place? And in addition, how do we then allow an opportunity to bridge with our community organizations who truly have so much to offer and are, ready and willing? They just want to know how, for the most part. So how can we really start to get all those resources in one place and have that wraparound care for our families? How can we break down some of the barriers that we've created by working in these silos? And how do we really truly start to build relationships of trust and of respect with our families, and base our work on what they truly need and want, what will benefit not only the schools but the communities, and therefore them in a cyclical way. So next slide, Andrew. Okay, so we started thinking about, this year is particularly challenging, of course, because now we're doing quite a bit on a virtual platform. So how do we even get started with family resource centers if we are hesitant to even welcome families onto campus right now because it may not be safe? So we developed a plan of action for 2021 that will lay a foundation and start our planning and our networking for years to come. So we're working with the PCNCs. In my complex, in the Kailua Kalaheo complex, we do have quarterly family engagement meetings, which is a little bit unusual for the DOE right now. But we're working closely with our PCNCs and all of our schools around family engagement right now. And we have 3 schools in the Kailua Kalaheo complex who are committed to starting family resource centers this year. And they all are lucky to have wonderful PCNCs who we are working with. So shout out to Waimanalo and to Kailua High School and Kailua L. if their PCNCs are on today. So they have committed with myself to that standards of quality training that Andrew was speaking of. And that training is around it's standards of family engagement. It's not just for family resource centers, it's for family engagement generally, but it definitely lends itself to giving us a framework for our family resource centers in our schools and keeping us accountable to the same level of standards that we'd like to see throughout, even though we know each school and each community will have its own unique needs and its own resources. And I just have to say that I'll just pause to say that working with Andrew has been amazing. And the training, I don't know if you've had a chance to check some of this out, but this organization is truly based on a heart for the work and not at all into making money. I was going to say that, Andrew, because you probably saw on the slide before, to belong to the national network is $650 a year per state. So it's very reasonable. He's very genuine and honest, and it's been very accessible to work with him. And I've just been so pleased to know that everything that we're doing is because we recognize the needs of families and that all of these different entities within the network truly want to support each other, and that is the motivation. So we're taking a look at the school's vision. We're working with each of those three principals to find out, what is their vision for their school and their unique family resource center. We're also about to give surveys out to the schools, to the families, and those PCNCs are co-collaborating to create those, to really find out from the families what they'd like to see, what they need in a family resource center, what would be helpful to them. We want to make sure that we are starting with the family voice when it comes to how we're planning our family resource centers. We don't want to make any assumptions about what we feel they might need or what they might be lacking. We want to start from a strength-based place where we recognize that all of our families come with funds of knowledge and that they probably have things that they can share with us and with other families if we give them the opportunity to really connect with each other and build that social capital within the school communities. The other support we have in my complex, we have an equity committee that we started to kind of bring the voice of our marginalized subgroup populations together to one table. So on our equity committee, we have our English language resource teacher, our Title I linker, we have our inclusive practices RT, we have our MVA liaison who helps us with families living with homelessness. We've had people from OHE on the committee as well. We work with all of these folks to make sure that we take a look at areas of inequity in our complex and think about how we can strengthen success for these groups within our schools. And our equity committee has taken the lead on supporting our family engagement trainings within our complex. And the equity committee will now work individually with each of the family resource centers to make sure that those PCNCs are supported around that group that they represent, around the needs that they might have, make sure that they're identified and that they are aware of the resources that exist to help those families. We are also this year focusing on making community partnerships, and I've been so very pleased at the amount of organizations and state departments that are interested in family resource centers in Hawaii. It's very exciting to have the opportunity to bring everyone together. We are also looking at how, while we're planning and building the foundation this year for a physical family resource center on these three campuses, we're also exploring ways that we might support virtually family resource center, like virtual family resource centers, so that we can start to get that social networking, connecting those resources and these kinds of things going in the midst of the pandemic, to do what we can do now. And then hopefully by next year, we'll be able to welcome families onto our campuses physically and establish that welcoming, accessible space for them on the campus. Okay, next slide, Andrew. Okay, so what do we see in the future for our family resource centers in our complex? We are hoping to have a focus on our English language learner students and families. In the three schools that I mentioned, we do have a high EL population. We'd love to have our PCNCs who would be working in the family resource centers to be working directly with the EL coordinators in those schools. We would like to see support throughout the day for our EL students at the Family Resource Center. Also support for families who might need access to filling out forms or resources, access to translators. And then afternoons would be tutoring and maybe even in the evening English language classes for families through our Family Resource Center. We want it to be multi-generational. So that means not only parent and me, toddler, infant and toddler classes, all the way from that up into hopefully Kupuna storytelling time, and really being able to share the connections between the generations. We are also looking a great deal at trauma-informed services. There are several grants right now we're working with around trauma-informed practices, and we're trying to coordinate some of that effort with the folks that are involved in those grants and that work around trauma. We know that now, more than ever, our families are experiencing a great deal of stress and or trauma, and we need to make sure that we are serving our families first around those basic needs, Maslow before Bloom. So we want to make sure that we are identifying and providing resources around trauma to really get the folks to the point where they can then think about what else they might need beyond the trauma that they're currently experiencing. So there's lots of opportunities out there for that. We're working with our school psychologists to talk about parent resource or parent support groups. Cultural connections. This is a chance for us really to bring cultures together. So for especially our EL populations, the cultures that they are coming to us with are not necessarily understood by the culture of the place, and vice versa. So this is a chance for those folks to not only connect with people from their own culture and build up that social network, but then also to connect with other cultures and to understand them and their culture as well, to hopefully give them a larger sense of belonging to the community and the greater community. There's also been so many, I've been listening to the wonderful free webinars that that Andrew's organization has provided all summer, and there's some exciting examples of university partnerships when it comes to providing parent education and parent support and after-school programming and sports programming and all kinds of things that you could do through university partnerships that I'm very excited about exploring. Also very excited about providing parents with more leadership development and opportunities in decision making in our schools, hopefully by establishing these trusting relationships then and beginning to really acknowledge the value that families have within our schools. We'll then be able to open up more opportunities and have them feel like they have more opportunities to participate in actually helping us to make decisions, not only around the Family Resource Center, but within the schools and then hopefully within the community as well. So these are all the exciting things that we're looking forward to. We have so many ideas, but we acknowledge that we are starting with our foundation. We want to build that strong first. We know that we can't start with too much too fast, but the nice thing is that now that we're finding out more folks in Hawaii are so interested, I feel confident that we can start a network here. And then I'm very excited about the possibility of joining with Andrew's network and actually having nationwide support so we can really make long-term change and have the capacity for that change for years to come with that support. So I just want to say thank you again to Andrew for the opportunity to work with you all and for being so very helpful throughout this process. I can't say enough wonderful things about the organization. Thank you.
Well, thank you, Kathleen, and for those kind words. And thank you to Kathleen. I think all of the folks participating today have a lot to be grateful for, because until Kathleen called me just, I think it was even less than 2 months ago, Kathleen, this moved really fast. Hawaii wasn't on our map, and we've been talking with different people over the years, but we're always looking for that one person who's going to be the catalyst, make the sparks to move something forward. And we found her, or she found us. So we're really glad about that. And in terms of some other points to cover for you, I mentioned resources that may be of interest to you to learn and explore more. So on the National Network website, which Kathleen has referred to, you can find lots more information about family resource centers, including research that's been done, parent testimonials. You can find even a virtual visit to an FRC in upstate New York, and they'll walk you through what it all looks like visiting one of these centers in person, since now we can't. You can also find information about what's going on in other states and how their states have FRCs and how they've been networked and the things they're focused on, and also tools that relate to developing family resource center networks. And I also mentioned the standards, of course, are there as well. In terms of services the National Network provides is facilitating connections to member networks. We also are glad to do presentations like this one for key stakeholders to help raise awareness of America's best kept secret. And we also support folks to explore network development like Kathleen is doing now, and we provide training. So the two trainings are the standard certification training and also another training which is about parent leadership development, which Kathleen was also referencing, developing sustaining effective parent advisory committees. And I'll say a little bit more about that in just a second. We also have free webinars, and so these free webinars are offered several Wednesdays a month. The next one is coming up on September 23rd, which is co-presented with Families Canada, which is the network of FRCs in our neighbor to the north. And we recently began a formal partnership with them, and one of the components is we're having them host present at this webinar about incorporating play into work with families and how important and valuable that is for supporting their strengthening and development. So that's coming up, and you can find the archive of past webinar Wednesdays accessible with all the materials and recordings and such on our website as well. There's a whole library there. The standard certification training. So this is what we've been so excited to tell you about. So thanks to connecting with Kathleen and the generous support of the Hawaii State Department of Health, the standards training will be coming to Hawaii later this month. So on September 28th and 29th, we'll have two virtual half days of this training, and there are actually 2 spots left. There are 2 spots left in this training, and I'm not exactly sure how we chat out a link, but we'll try to do that if you may be interested in those spots. In particular, Kathleen's looking for folks to participate who have an interest in moving this forward. So given what you've heard her talk about, the vision for FRCs with the schools and thinking further about network development, if that's the kind of thing that's sparking your interest, we especially encourage you to consider participating in that training. There'll also be when it fills up, there'll be a wait list that pops up, and we encourage you to add your names to the wait list, because that will also give us a sense of people who can who we want to have future trainings for in moving forward. There's also another training that's coming up that has space left that is on October 6th and 7th that the National Network will be offering. So that's another one that you can register for, and the link for that is on the website. This is the training I mentioned I'd say a little bit more about. So we looked across the country and saw that there was lots of great training to support parents in terms of developing their leadership skills and finding their voice and navigating through systems, advocating for their needs. But what we found that there was not something similar on the staff side. So the parents would be all dressed up, ready to go, but our programs were not necessarily ready to welcome parents in terms of shared leadership, in terms of shared decision making that Kathleen referenced as well. So we created this training specifically for staff. So this is a training for staff about how to support parent leadership development through a very, very particular structure, the Parent Advisory Committee. So how do we as staff step back and let parents step forward? How do we truly partner with them? And how do we set up our programs in a way where they can make meaningful decisions and be engaged in the leadership of them? So that training's coming up in October. Every time we offer it, it sells out like that. It is incredibly popular. There's no other training like it. And we also have a virtual conference. So since you love conferences, you're at this one. There's another one coming up next month, just just a month from now, the Together for Families conference, which we do every 2 years. It's a big, this year, virtual course conference with lots of different national organizations in the US and Canada that has a number of different tracks, all focused on working effectively with families. So this year, there's a whole track, for example, on advancing equity with families, in addition to a number of others as well. And it has its own website, togetherforfamilies.org. So we're interested to hear what you may buzz about having heard this presentation, what stands out for you, what you'd be interested to explore further. We'd love to hear your thoughts. And as our time will be out really soon, make sure you have our contact information as well so that you can follow up. Particularly Kathleen is your key contact because she's the catalyst in Hawaii moving things forward. So that's our presentation for you, and look forward to hearing your thoughts.
Mahalo for sharing. So if there's just one question, it's what would be the difference between a parent advisory committee and our current SCCs?
Yeah. So in terms of SCCs, so in terms of parent advisory committees are a term used for these committees that are specifically of parents. So they're different than community advisory committees that might include parents and community members or business leaders or other kinds of folks. So these are groups that are just parents. And so in school systems, sometimes there is support for how to work effectively with parents in leadership positions like that, in structures like that. But in general, for other kinds of social service organizations, there really isn't support to help people with that. So for those of you who are working with parents in the schools and those kinds of structures, I think through this kind of training, you'd find a lot that would be very much applicable. And you may also have other resources through the schools that are helping you to build effective SECs.
Thank you. At this time, we have no more questions unless anybody else has a question.
I'd just like to say, truly, if anyone wants to talk about any of this or has more questions or wants to just brainstorm, I'm always available and happy to discuss it. And I will look for opportunities to continue to share the work that we're doing so you all can follow what's going on here in Hawaii. And I just want to say thank you very much for taking the time to learn about Family Resource Centers and about the work that we're doing.
Well, thank you very much, Andrew and Kathleen, for this not a secret for us anymore. We look forward to the exciting things that are being planned for the state of Hawaii.